Hello, everyone. How's everything going? All right. Can you guys hear me okay? Hi, Shawnette. How are you? Can you hear me okay, Shawnette? Okay. Awesome. 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 Okay. So, not too many. Hello, Mr. Miko. Not too many slides tonight, guys. Just a few. It's a rheumatoid arthritis, so not too many, but this is very important. It's a very important system disorder. They want us to know rheumatoid arthritis. And in my opinion, they love to put it against osteoarthritis. So we'll do osteo on Friday. So just really this week, sink in, really think about rheumatoid arthritis. Look at some pictures, look at some images. So this is one question you know for a fact that you will get correct. Okay. So rheumatoid arthritis, it will definitely be on the exit. Okay, because there's a certain lab values, and again, they love to pit this against osteoarthritis, so it's a biggie. All right, so this is just a disclaimer. All right, this is called fair use and is allowed for purposes of criticism, news reporting, teaching, and parody, which doesn't infringe of copyright under 17 USC 107. All right, and the disclaimer: the views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other groups or individuals. So, this is just a disclaimer. All right, so let's talk about pathophysiology. All right, so the cause of RA, the cause of rheumatoid arthritis, guys, it is not known. No one really understands autoimmune disorders. They understand the pathophysiology of it and they know some things cause it, but really no one understands or knows what causes RA. Okay. It is not known what triggers the onset of RA. Again, they do have some risk factors. They do talk about some different infections and viruses that may start rheumatoid arthritis, but a definitive answer, no one really knows. All right. In rheumatoid arthritis, the focus of the inflammation is the synovium. So I want you guys, inflammation and synovium. That's the issue. Inflammation and synovium. All right. This is a tissue that joins the tissue that lines the joint. So what's happening is the synovium is becoming inflamed. And it's an autoimmune process, okay? But that's the main focus. So I want you to put inflammation and synovium. All right? The synovium is a tissue that lines the joint. And so with rheumatoid arthritis, it becomes inflamed. All right? So immune cells release inflammation causing chemicals. All right? Chemicals. Whenever you see inflammation and chemicals, you know that this patient is going to experience some type of pain. And these chemicals can damage cartilage and bone. So I want you to really think about the damage when someone has rheumatoid arthritis. Just look at their hands, just look at their joints. You can tell it's painful. All right. You can tell damage is being done. All right. Pathophysiology. Key term here. One of the main things, guys, that you have to remember is bilateral symmetry. So the right damage is going to look like the left damage. And that's the complete opposite of osteoarthritis. Okay, but we'll talk about that on Friday. Bilateral symmetry. And I want you to write down periarticular soft tissue swelling. Periarticular soft tissue swelling. Periarticular soft tissue swelling. Pathophysiology is the uniform loss of joint space. So that's where that damage comes in. Okay, uniform loss of joint space. I want you to write down marginal erosions. Marginal erosions. Listen to erosions. Inflammation and pain, guys. All right, erosions. That's never something you want to hear when it comes to your joints. And then joint deformity. Okay, joint deformity. That's a big issue. All right, joint deformity. So pathophysiology. So I just wanted you to kind of get a picture. This is an X-ray. All right, give you a visual. This is an X-ray. All right. So just imagine all of those things that we said. Bilateral symmetry. There'll be bilateral symmetry damage. Periarticular soft tissue swelling. There will be uniform loss of joint space. Marginal erosions. Joint deformity. So that's what you would see with someone who has rheumatoid arthritis. All right. That's what you're going to see. You're going to see all these things: joint deformity, marginal erosions. You're going to see uniform loss of joint space, particular soft tissue swelling. All right. Now look at this side. The inflammation can extend to the cartilage. The inflammation can go to the bone. The inflammation can go to the tendons. The inflammation can go to the ligaments that surround the joint. So there's going to be inflammation. So pain, discomfort, deformity. All of these things are going to be present with this patient that has rheumatoid arthritis. It extends to the cartilage, guys, the inflammation. It extends into the bone, the tendon, and the ligaments. So now can you understand why the patient has disability? All right, can you understand how the patient is going to present? It's basically just destroying everything. It's destroying the cartilage, it's destroying the bone, guys, it's destroying the tendons, the ligaments that surround the joint. And also, do you hear that when it comes to osteoarthritis? Okay. Remember that, because they love to pit those two against each other. Now, pathophysiology. Okay, a lot of patho, because I want you guys to really understand rheumatoid. All right. So pathophysiology, guys. The common structures affected are the blood vessels are affected. The pleura surrounding the lungs can become affected, guys. And the pericardium can become affected. Okay. And the eyes, guys. All right. Iritis and scleritis also develop in the eyes. Iritis and scleritis, guys. Iritis and scleritis can develop in the eyes. Okay, so the common structures affected are the blood vessels, the pleura surrounding the lungs, and the pericardium. Iritis and scleritis can develop in the eyes. That's from rheumatoid arthritis. So now it's intense. So now you can see the severity of this system disorder. All right. So remember that the blood vessels. All right. These are common structures that are affected. All right. So now look at this picture here. All right. So I want you to remember bilateral symmetry. So both will be affected. What happens to the left will happen to the right. Both will be affected. Whatever happens to the left will happen to the right. All right. Bilateral symmetry. Okay. Whatever will happen to the left, guys, is going to happen to the right. All right. So some more pathophysiology, guys. More pathophysiology. The natural course of the disease is one of exacerbations and remissions. Exacerbations and remissions. So basically, the patient will have a flare up, and then sometimes they won't. They'll have a flare up, and sometimes they won't. Okay. Now, if rheumatoid arthritis is diagnosed and treated early, it is possible to avoid permanent joint damage. All right. So if it's treated early, guys, they can save the joint, or they can prevent the joint from getting worse. All right. Just keep in mind the natural course of the disease is one of exacerbations, guys, and remission. Exacerbations, then remission. So the patient will be fine sometimes, guys, and then sometimes the patient will have flare-ups, inflammation, painful inflammations. All right. So, health promotion and disease prevention. You guys know this is us, health promotion, disease prevention. This is what we do. We promote health. Hey, Miss Amy. We promote health and disease prevention. So, how do you promote health? Or how do you prevent rheumatoid arthritis from happening? It's an autoimmune disorder. So, this is something that you'll have to do with the patient after the patient has been diagnosed and showing signs and symptoms. So, health promotion and disease prevention for your patient who has already been diagnosed with rheumatoid arthritis. All right. So, one thing that you need them to do is adaptive devices, because the last thing you want is for your patient to become dependent on anyone. Okay. You know, when someone becomes dependent, the quality of life decreases. So, adaptive devices, guys, that prevents the development of deformities. Okay. And we want them to use the affected joints, continue using affected joints. And guys, ambulating and maintain function and maintain a full range of motion. All right. Health promotion and disease prevention. Remember, we're promoting health in this patient who has rheumatoid arthritis, and we're preventing the joints from becoming just completely damaged and unused. So we want to encourage the client, use the affected joints. We have to teach them how to use their adaptive devices, okay? Because we foster independence as nurses. So when you see health promotion and disease prevention, just remember we foster independence. So we want them to use their adaptive devices, and we want them to use the affected joints. All right. So this is the population that's at risk. Okay? This is the population that's at risk. Okay? Female, age 30 to 60, guys. So 30 to 60. I want you guys to really focus on that. 30 to 60 years old. So imagine the amount of emotional support that you'll have to do this to give. This is the type of person that we really, 30 to 60 years old, guys, that's very young. So adaptive devices are very important, because we don't want this person to decline from 30 to 60, guys. Okay. So if genetic predisposition, some people are just genetically predisposed to have rheumatoid arthritis, guys. And very, very important, very, 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 very important, extremely important, bacterial or viral infection like the Epstein-Barr virus. Okay. They're saying this might be a trigger. This is a trigger. This may start the rheumatoid arthritis to present. All right. So Epstein-Barr virus, guys, remember that. Okay. Epstein-Barr. Stress and smoking, environmental factors, guys, and older age. So these are all the risk factors for the person that may get rheumatoid arthritis or start to present with signs and symptoms of rheumatoid arthritis. So remember that. Remember that Epstein-Barr. So I put a little picture here, a little mite. Well, it's not a virus, but whatever. All right. So bacterial or viral infection. All right. Particularly Epstein-Barr virus. Mm-hmm. Okay. So just be very aware of that. All right. Now let's talk about some expected findings. What can you expect with rheumatoid arthritis? So one of the key words, guys, I want you to remember. I want you to remember for expected findings, guys. I want you to remember systemic. All right? Systemic. So this patient, it actually can present all over the body, and I'm going to give you some more examples, okay? I'm going to give you some examples. I want you to actually write this down. This is very important, so I don't want you to read this. I want you to actually write this down, okay? Something that I found that I think you guys will really, really appreciate, but I want you to write it, okay? Because remember, they're going to pit this up against osteoarthritis. So I want you to write down swelling and inflammation. Swelling and inflammation. Bilateral. Okay? Bilateral symmetry. Okay? I want you to write down, guys, depression. Depression. Okay? Because look at the age of someone going through this. I want you to write down nodules. Nodules. This patient may also present, guys, with low-grade fevers. Remember, it's systemic, so it can affect the entire body. Okay, so type in the chat just one thing that I said, one thing, because it's very, now this part, guys, expected findings are extremely important. So I really want you guys to understand this part, because they love to pit this against, osteoarthritis. So write in the chat just a few things about rheumatoid arthritis. Nodules, yes. Systemic, yes. Systemic nodules. And guys, also, I want you to remember depression. Okay? Make sure that you remember depression. Okay? Big deal, guys. All right? So we're going to talk about some more expected findings, because I saw a lot of questions on expected findings. Okay? Very important. So we have laboratory. All right? Let's talk about some of the important labs. These are all of the labs, guys. Rheumatoid factor. So that one will be okay for you. Okay, you'll remember rheumatoid factor. All right. You're going to remember synovial fluid analysis. Synovial fluid analysis. ESR will be elevated. C, reactive protein. And remember ANA. ANA. So we have the rheumatoid factor, guys. That will be easy because the rheumatoid factor, okay, elevated ESR and C reactive protein along with ANA. These are the laboratory tests that they will use to kind of give the patient a proper diagnosis, okay, a definitive diagnosis. That along with symptoms, guys, signs and symptoms, okay, that's how they'll determine if this patient has rheumatoid arthritis. Because remember, 30 to 60 years old, they're going to make sure that it is what they say it is. They don't want to give any false diagnosis. So they'll do the rheumatoid factor, guys. They'll do the synovial fluid analysis. They'll do the ESR and the C reactive protein. And remember the ANA. Okay. They'll also do, guys, they'll do the arthrocentesis. And what will happen is they'll actually pull the fluid from the synovial fluid from the joint, and they'll examine that. Okay, arthrocentesis, make sure that you remember that. And they'll do x-rays, guys. And you know, x-rays can tell the extent of the damage, not for the tendons and the ligament, but they can actually see the cartilage. All right, so remember x-rays. Now, most important, guys, one thing you have to remember, we're not going to get stuck on pathophysiology because we're nursing. So the board wants to know that you know how to take care of nursing. They want to know that you are a nurse. They want to know that you can take care of your patient who has rheumatoid arthritis. All right. So what should you do? You want to assist. You want to assist with and encourage physical activity. All right. You want this patient moving. Okay. Joint mobility. Okay. Monitor for indications of fatigue. Rest, guys. It's okay. You want the patient to maintain physical activity and you want them to rest in between. Find periods of rest. Okay. Because remember, stress can cause a flare up also. Teach the client measures to do the following, guys. Teach them to maximize the functional activities. So whatever they can do, encourage them to do it. Maximize the activity. Minimize the pain. Rest, frequent rest periods. It's okay. Monitor skin closely because a lot of our patients are on immunosuppressants, guys. So you don't want them to get any type of infection. And you want to always provide a safe environment, guys. So this patient will be a fall risk. So you don't want any clutter around this patient. You want to make sure that this patient is in a safe environment. Okay. Encourage and give referrals to. Make sure your patient is seeing a physical therapist, guys. Physical therapist. Now, referrals are a big deal, okay, for us. Make sure there is a referral for a physical therapist. Make sure there is a referral for occupational therapists. And keep in mind, that's two different specialties, two different things. There are support groups. There are support groups, guys, for rheumatoid arthritis. There are support groups. This is good for coping, okay? And assistive devices. That patient has to know how to use the assistive devices. We facilitate, we foster independence, okay? Remove unnecessary equipment and supplies because we don't want our patient to fall. Remember, we need a safe environment, maintaining a safe environment for this patient, and monitor for medication effectiveness. These medications, guys, can cause some serious adverse effects. So if it's not working, we need to make sure that we let the physician know. Okay. So we're monitoring to see if the patient is able to move a lot better, if the patient is experiencing less pain, if the patient is not being having chronic or reoccurring inflammation. Is the medication working? So if it's not, you need to let the physician know. Okay. Make sure, guys, that you know about physical therapy. This patient with rheumatoid arthritis, guys, they have to have a physical therapist on board. So as a nurse, guys, I know we have to work within the scope of practice. But if I have a patient who has rheumatoid arthritis and he doesn't have a physical therapist on board, I definitely need to let the doctor know so we can get him a referral or get her a referral. All right. Because remember, the assistive devices, we have to teach this patient how to move, functional, like as much as they can do, we want them to do it for themselves. Okay. And guys, nutrition. You know, you don't heal without nutrition. All right. Proper nutrition. Okay. You can decline, guys. All right. If you're not eating the correct food. So, vitamins, this time is protein, guys. Protein and iron. Believe it or not, protein and iron. Okay. And we encourage this patient to eat small, frequent meals. So remember, guys, highlight, remember, I don't know if you have your protein diets, but this is definitely the time for protein. Okay. And medications, guys. Medications. Okay. So just take a look at these meds. Take a look at these meds. And the one thing I want you guys to remember are the major side effects that come along with these medications. Okay? If someone is on NSAIDs, guys, okay, the patient is on NSAIDs. Of course. All right? What are the side effects for this? NSAIDs. GI bleeding. Okay, so if I know that a patient has rheumatoid arthritis, this patient is going to be on NSAIDs for quite some time. So I need to make sure that they are aware of GI bleeding. That's coffee grind, emesis, okay, and or black tarry stool. If the patient complains of any of these things, guys, we need to let the physician know right away. Okay, bleeding, COX-2 enzyme blockers. If a patient has a history of MI, they cannot use this medication. All right. If they have a history of MI, COX-2 enzyme blockers, it is a contraindication. They cannot use it. Now, corticosteroids. That's a huge issue. Corticosteroids, guys, because this patient has to lifestyle change now. We have to monitor the blood glucose, right? This patient cannot go out in crowds anymore because the patient is immunosuppressed. Okay. This patient has to be very, very careful because if you're on corticosteroids from the age of 30 to the age of 40, you may develop Cushing's. So we have to monitor for that. If a patient is on long-term steroid use, we have to also look at the skin. Okay? Because the skin becomes very thin and brittle. Okay? So make sure that you guys remember that. And if a patient is going to take steroids for long-term use, they need a PPI, a proton pump inhibitor, a PPI, because corticosteroids, guys, causes peptic ulcers. So this patient needs a PPI. So there's a host of issues that come along with corticosteroids. All right. So we have to definitely, for sure, educate the patient that if they're taking these steroids for long-term use. Okay, they're very effective medications, guys. Steroids are very effective, guys, but they have a lot of issues. Okay, a lot of side effects, a lot of adverse effects. Corticosteroids, guys, this patient has to be tapered off of this medication. They cannot stop this medication abruptly. They have to be tapered off. Okay. And with DMARDs, guys, it also has side effects. But the one thing I want you guys to know about DMARDs is if pregnancy is contraindicated if they're taking DMARDs, guys. Okay, pregnancy. They have to take a pregnancy test. They have to make sure because they'll it can cause some major problems with the fetus. So make sure pregnancy. Okay, make sure that the patient understands and is make sure the patient is on some type of birth control. All right, so therapeutic procedures. What can we do if the patient is experiencing inflammations or pain? Just pain that the patient, how do you say, like unrelieved pain, multiple inflammations, multiple exacerbations. So they have to do something, guys. All right. So they'll do plasmapheresis. They may have to do a total joint arthroplasty, and they may have to do a synovectomy. All right. Just to provide the patient with some type of relief. All right. Just to give the patient some type of relief. And believe it or not, guys, interprofessional care. All right. It's very important for us to make sure that everyone is on board that should be on board to help this patient. So, interprofessional care. We have to give referrals to support groups. If you are a case manager or if you work with a large amount of patients that have rheumatoid arthritis, you'll know exactly how to direct them. Occupational therapy, guys, for adaptive devices. That's very important, guys, because remember, we foster independence. Okay, ADLs, we want them to do whatever they can do for themselves. And guys, a home health aid may be necessary for assistance with ADLs. Okay, be with assistance though. Do not take everything on. We don't want anyone to become dependent. Now, client education, big deal, a big to do. Okay, client education. Now, this is very important when it comes to the heat and cold. All right. So, for morning stiffness, guys, hot shower. This will kind of loosen the patient up. The patient can get on with their day faster. And when they have the pains in the hands and the fingers, guys, you want to do heated paraffin. So you can do this at some facilities. They do manicures, and you can even buy these machines, but you have to be careful. All right, tell the patient to be extremely careful because remember, they may not be able to maneuver the way that they once were able to. All right, and now for edema, it's cold therapy. So for morning stiffness, guys, it's hot shower, and then for edema, it's cold therapy. And conserve energy. So space out activities and take a rest period. Because remember, this condition is systemic. So you may have a patient that is experiencing some fatigue. It's systemic. So the patient very well may experience some fatigue. And follow routine health screenings, guys, because this patient is on NSAIDs, corticosteroids, DMARDs, and there are so many side effects, so many adverse effects just with those medications, just for the treatment. So they have to make sure that they are following their routine health screenings. Also, you have to teach the patient how to relax. So muscle relaxation techniques, guys. And any type of infection like temperature, unrelieved pain, pain upon inspiration. This patient has to notify the physician right away because remember that rheumatoid arthritis can affect vessels, blood vessels. This rheumatoid arthritis can affect your eyes, guys. It can affect your thorax, your chest, your breathing in and out, inspiration, expiration. All right. So make sure that the patient goes to the physician and notify someone right away. Any type of infection, any type of chest pain, guys, They have to notify the physician right away. All right. And of course, we do coping mechanisms, and we can do non pharmacological therapies to help the patient as well. Guys, I started doing hypnosis for some of my students, and all of my students so far have passed the exit with the I learned this hypnosis, and it has really helped a lot of my students pass their exams, hypnosis and everything. I'm just I don't know hypnosis. I'm just messing with you. No, I don't know hypnosis. But hypnosis, okay? So all of these things all of these things help. All right? I'm just teasing. Just want to make sure you're awake. All right? So sometimes, guys, with the acupuncture and uh the massage, it can help. The paraffin wax, all of those things help rheumatoid arthritis, guys. What you want to do is you want to basically tell the patient or show the patient relaxation techniques and stress and coping, because guys, once the patient becomes overwhelmed, then the exacerbations, the flare-ups occur. So you want to make sure that your patient is aware of how to basically just calm down, coping mechanisms, so they don't experience so many flare ups throughout the year. And because our goal basically is to make sure that they have a high quality of life. All right. All right. So these are the complications, guys. So look at this syndrome here. All right. All right. So Sjogren's syndrome, guys. This is a complication of rheumatoid arthritis. Unfortunately, the patient will start to experience like dry mouth, dry eyes, dry nasal mucosa, even tooth decay can occur. Okay, this is a complication of rheumatoid arthritis. And guess what? Osteoporosis is also a complication of rheumatoid arthritis, osteoporosis. All right. So make sure that your patient is doing weight bearing activities every day. We want to encourage our patients to stay physically active, and weight bearing activities can kind of help prevent this complication from occurring. And vasculitis, guys. Vasculitis. If you see a picture, again, I couldn't put the picture here, but vasculitis, it can be so severe. All right. So make sure you Google what vasculitis is. It is also a complication of rheumatoid arthritis. So muscle aches, fever, abdominal pain, cough, joint pain, and of course, the respiratory. Remember, we're nurses, so we have to be aware of our ABCs, okay? So, rheumatoid arthritis can also cause respiratory complications. So, the inflammatory process can lead to lung tissue complication, guys. This patient can have pleurisy, pneumonitis, diffuse interstitial fibrosis, pulmonary hypertension, guys. Pulmonary hypertension. Okay, so make sure that you guys are aware of that. So again, respiratory complications can occur from rheumatoid arthritis, guys. Okay, rheumatoid arthritis. So this is pleurisy, pneumonitis, diffuse interstitial fibrosis, and pulmonary hypertension. Cardiovascular complications. So the inflammatory process can affect cardiac tissue, guys, leading to pericarditis, myocarditis. So this patient is going to be on anti-inflammatory agents. So just keep in mind, rheumatoid arthritis can pretty much affect every system of the body. All right. So look at pericarditis versus myocarditis. Pericarditis. Okay, so that's like conditions caused by inflammation of the pericardial sac. And there's different types of myocarditis, but I put one, dilated cardiomyopathy, to kind of give you guys an idea. So pericarditis and myocarditis. And again, guys, this is a complication from rheumatoid arthritis. Okay. And guys, these are just the credits. So make sure, guys, rheumatoid arthritis, that you look at vasculitis. Make sure that you look at that. And make sure you guys look at the risk factors and the expected findings. All right, expected findings. All right, a big deal. All right, guys, I told you it wasn't going to be too much. So Friday we are going to do osteoarthritis. All right. So I will see you guys then. You're welcome, guys. Good night. And just email me if anything. Good night, guys. See you tomorrow. Oh, yes, tomorrow. All right, guys. And see you Friday also, guys. We'll do osteoarthritis. All right. See you then. No problem. And remember, the PowerPoint will be in the description link. All right, guys.